Around World AIDS Day, it's really important to note there are many reasons for hope.
HIV/AIDS remains one of the most significant public health challenges we're facing, particularly in low and middle income settings. Globally, it is estimated that only 60% of the 37 million people living with HIV are receiving adequate treatment. And it is estimated that there continue to be over 1 million new infections per year. More than 1 million people are living with HIV in the US, and it is estimated that 1 in 7 are not aware of their HIV infection. Tremendous advances have been made in HIV/AIDS since the early days of the epidemic when the virus was first discovered. HIV is no longer a death sentence as it once was. It is now considered to be a manageable chronic illness with the possibility of a normal lifespan. It is now known that a person living with HIV who is adherent to their treatment and achieves a suppressed viral load is unlikely, and some would even say impossible, to transmit the virus to their sex partners, as well as from mother to child during pregnancy and childbirth. In addition to condom use for protection of HIV transmission during sex, we now have PrEP, pre-exposure prophylaxis. PrEP refers to a daily dosing of medication for people at risk for acquiring HIV. In the HIV field, scientists are now working on other modes of delivery besides daily oral medication, including long-acting injectables and implants. There is now great optimism for the potential of ending the HIV epidemic with wide-scale implementation of prevention and treatment.
We still face many challenges in scaling up advances in treatment and prevention due to economic, social, and health disparities in vulnerable populations. Depending on the context or where in the world we are, these vulnerable populations include racial and ethnic minority, young men who have sex with men, young adolescent girls, youth with perinatally acquired or behaviorally acquired HIV, racial and ethnic minority women, injection drug users, transgender women, and people who engage in sex work for survival. Unfortunately, these populations face many intersecting stigmas that can get in the way of HIV prevention and care. Relevant to this department, one of the biggest challenges we face are the high rates of comorbid mental health problems in people who are vulnerable to HIV acquisition or people who are living with HIV. 30 years into the epidemic, psychiatric disorders, including substance use disorders, but also depression and anxiety, can represent the most significant barriers to ending the epidemic. The good news is that in the mental health field in general, we have excellent tools for assessing mental health problems, and we have evidence-based interventions that have made significant advances in treating mental health problems. However, the more difficult issue is that given the stigma of HIV and mental health problems, as well as limited resources for mental health professionals and treatment, we've had the challenge of scaling up these interventions and tools in the context where many people living with HIV are. One strategy that may be critical is doing a better job of integrating mental health care into all HIV testing, treatment, and care settings.
Unfortunately, the stigma of HIV can lead to significant psychological distress. Since the science supports the reality that a person living with HIV with a suppressed viral load cannot transmit the virus, there's now a growing active campaign in the community called U=U, which means undetectable equals untransmittable. Reports indicate that the U=U message leads to reduced stigma and feelings of shame and guilt. With the success of PrEP in significantly reducing the risk of acquiring HIV, we're also seeing that it's leading to reduced anxiety and depression among those people who are at risk.
Around World AIDS Day, it's really important to note there are many reasons for hope, but also there is still significant work to be done, particularly around scaling up treatment and prevention for the most vulnerable populations in the US and globally.